Welcome back. It's an issue that researchers say affects millions of Americans. Blockages in the leg vessels can cause pain and eventually lead to amputation.
But there is a new treatment. Dr. Yazan Khatib and the team at First Coast Cardiovascular Institute are leading the way with that treatment. Welcome, Dr. Khatib. Thanks for being with us.
Thank you. It's
Yes,
a pleasure
absolutely.
to be here.
Before we get into some of the treatment options, tell us a little bit more about blockages in the leg vessels.
Blockages in the leg vessels, known as PAD, for peripheral arterial disease, are actually fairly common, affecting, depending on who you read, up to 12 million Americans. The risk factors for them are no different than the risk factors for blockages in the heart and the brain vessels that we know about.
Which are what?
Which are basically a family history, smoking, diabetes, high blood pressure, high cholesterol, sedentary lifestyle. And the more of those risk factors you have, the more likely you are to be afflicted with those blockages at a younger age. It's a process that really starts, all of us, by the time we're 40, we do develop some plaque, even the healthy ones of us. But those who do not have any of those risk factors go to 80, while those plaques are still very mild. The more of those risk factors you have, the more likely those plaques become severe, block a vessel, cause a symptom, be it a leg pain when you walk, or in cases of more severe, an ulcer that then puts you at high risk for amputation if blood flow is not restored.
And we'll get to the new technology that you guys have in just a minute, but before this new technology, what did you have to go through to open up these blood vessels?
Well, I mean, the field of cardiovascular medicine had witnessed nothing short of a revolution in the past 20 years. So 20 years ago or so, the only options available were bypass surgery, or if that failed, then an amputation. Both very drastic measures. As the video footage will show, over the past 20 years, we started with what's called endovascular repair approaches, where in essence, we go with a puncture in the groin or in the wrist through a needle, not more than 2 millimeters wide. We put a catheter, which is basically a hollow tube, inside the vessel, and that catheter then could be advanced over wires that could range in diameter from less than a millimeter to even slightly more than your hair, literally. And those catheters can be advanced from anywhere we go to anywhere we need to go. So many times we go from the right groin all the way into the left leg. Once we find the blockage, then we frequently cross it with specialized wires that are very thin. And then over those wires, we advance the equipment that we fix the vessels with. Many times that's a balloon with which we dilate the vessel. Sometimes it's a rotor-rooter type of device. But in most cases, we're finding ourselves moving more and more to putting stents, which a stent is basically a metal scaffold, cylindric in shape, that once implanted in the vessel, it prohibits the process of recoil from taking place.
So even over time now, there's no worry that that area at least is going to build.
Well, unfortunately, without drugs in place on the stents, there is still a high risk of restenosis, of re-narrowing. So what we learned as cardiologists when we were doing this procedure in the 90s for the heart vessels is that the risk was very high. In 2004, drug-eluting stents were approved for the heart, and we really noticed a huge reduction in the incidence of recurrence. Unfortunately, it took a long time for drugs to be approved on stents for the legs. Finally, they got approved in Europe and Asia about 2 years ago.
Oh, okay.
2 years ago, really, for the legs. And we finally got them approved here in the U.S. In December of this past year for the stents on the legs. And with that, we really are starting to reap the benefit of reducing the risk of re-narrowing further.
So this really is new technology.
Well, in the U.S., it's definitely very new. It took a long time to approve it in the U.S. by the FDA, but it's finally fully fledged approved technology.
That's great.
That's great,
Wow.
yeah. Now, where can patients get this technology, and really, who is it best suited for?
Well, I'm very proud and humbled to say that the team at First Coast Cardiovascular Institute was among a handful of teams that that participated in the research leading to the approval of this stent over the past 6 years. And also very proud to say that we in the University of Florida, Gainesville, were the first in the state to have them available, and until now, almost the only ones in the States to be implanting them. Much like we witnessed with the heart, I expect probably about 30% of the patients will need this at the beginning. This is what we started with the heart, with drug-eluting stents, and now we're implanting them at almost 80%. But I think those will be the patients who are at the highest risk of restenosis because the technology is expensive, and it's not quite paid for. So, but mostly diabetic, young people, and those who have had prior recurrence of re-narrowing.
And now you say it's not just because people that don't have symptoms can also have this blockage. What should somebody be looking for? What can we do at home to check to see if we might have one of these problems?
Very, very good question. Very good question. The fact is that more than 50% of the patients do not have symptoms. Yet nonetheless, those very same patients without having symptoms do indeed have real risk of heart attack and stroke. And so it starts by the patient being an active participant in their health care, knowing their risk factors, not to put their head in the sand. If you know you have diabetes, you know you've been a smoker, you know you have a family history, you're at high risk. When you go to your doctor, take your shoes off, and make sure your doctor feels your pulses. Even if you have no symptoms, there is no pulses in your foot, you are someone who needs to see a cardiovascular specialist to reduce your risk of heart attacks and strokes.
Can we do that ourselves at home?
Well, you can do it. I wouldn't trust myself.
Okay.
You know, I wouldn't trust the patient. I really think it needs to be done by a healthcare provider.
Okay.
You said be vigilant. Ask your healthcare provider to check it out for you because you are having one of these risk factors.
Absolutely.
Okay.
Absolutely.
So if you're watching at home and you're wondering, oh gosh, am I at risk potentially? There's a lot of information we just shared, but where can they go to get some more information about this?
Well, there's a Save a Leg, Save a Life Foundation that I started with Dr. Bell and Ms. Bell a while back. That's a good resource. Our website is also a very good resource, firstcoastcardio.com, and you know, we have dedicated 14 physicians ready to answer and to address this question and problem.
Excellent. Well, thank you so much.
Thank
Vital information.
Yes.
We also like to thank First Coast Cardiovascular Institute for sponsoring this segment. Remember to know your body, know your risk factors, and work with your doctors to address them.
If you want more information about PAD or First Coast Cardiovascular Institute, visit firstcoastcardio.com or call 904-493-3333.